Hello, future nurses. Are you preparing for the NCLEX RN exam? Myocardial infarction questions are very common on the exam, and understanding the key concepts can help you answer them correctly. In this video, we will review 3 NCLEX style questions about myocardial infarction. After each question, I will explain the correct answer and the rationale so you can improve your clinical thinking. Let's begin. Question number 1. What is the most common cause of myocardial infarction? A. Coronary artery vasospasm. B. Coronary artery thrombosis from a ruptured atherosclerotic plaque. C. Congenital heart defect. D. Pulmonary embolism. The correct answer is B. Coronary artery thrombosis from a ruptured atherosclerotic plaque. Most myocardial infarctions occur when an atherosclerotic plaque inside a coronary artery ruptures. This rupture causes platelets to aggregate and form a blood clot. The clot blocks blood flow to the heart muscle, leading to ischemia and tissue damage. Remember this important concept for the NCLEX. Myocardial infarction usually occurs because of a blockage in the coronary arteries. Question number 2. Which cardiac biomarker is the most specific indicator for diagnosing myocardial infarction? A. Myoglobin. B. Troponin. C. Creatine kinase. D. Lactate dehydrogenase. The correct answer is B. Troponin. Troponin is the most sensitive and specific biomarker for heart muscle injury. When myocardial cells are damaged during a heart attack, troponin is released into the bloodstream. Elevated troponin levels are therefore a strong indicator of myocardial infarction. For NCLEX questions, if you see the phrase most specific cardiac marker for myocardial infarction, the correct answer is usually troponin. Question number 3. Which symptom is most commonly associated with myocardial infarction? A. Sharp pain relieved by deep breathing. B. Crushing substernal chest pain radiating to the left arm or jaw. C. Pain relieved by eating. D. Intermittent abdominal cramping. The correct answer is B. Crushing substernal chest pain radiating to the left arm or jaw. This is the classic symptom of myocardial infarction. Patients may also experience shortness of breath, sweating, nausea, and anxiety. Chest pain that spreads to the arm, jaw, or shoulder is an important warning sign of a heart attack. Here is a quick NCLEX memory tip. Remember the myocardial infarction triad: chest pain, electrocardiogram changes, and elevated troponin levels. Keeping these 3 points in mind will help you answer many NCLEX questions related to myocardial infarction. If you found this NCLEX practice helpful, please like the video and subscribe for more nursing exam preparation content. Comment below if you would like more practice questions on cardiac disorders or other NCLEX topics. Thank you for watching and good luck with your nursing studies.